Hello everyone. Today we're going to be discussing a question from Typical PT's platform. Let's jump right in. Alright, here's the question. A 45-year-old patient with a past medical history of hypertension, hyperlipidemia, and osteoarthritis presents to physical therapy with complaints of joint pain in the right elbow. The patient works in construction and handles the crane operations. His pain has been present for several months and has not improved with over-the-counter pain medication. On examination, the physical therapist identifies an active trigger point in the right elbow. The therapist decides to perform dry needling on the patient. During the procedure, the patient suddenly complains of pain in both the left and right arms. What mechanism is most likely causing the pain in the left arm? A. Referred pain due to trigger points. B. Puncture of the radial nerve via the needle. C. Activation of wide dynamic range neurons. D. Mismanagement of signals in the secondary interneuron. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is C. Activation of wide dynamic range neurons. Answer choice C is correct. Wide dynamic range, or WDR neurons, are a type of sensory neuron that respond to a wide range of stimuli, including both innocuous and noxious stimuli. These neurons are found in the dorsal horn of the spinal cord, and they play an important role in the transmission of pain signals. A key feature of WDR neurons is that while they can detect pain sensations, they cannot determine the exact location of the pain. Because of this, a pain sensation that originates on the ipsilateral side can sometimes produce a perception of pain on the contralateral side. In this scenario, the patient is receiving dry needling on the right elbow, but suddenly experiences pain in both arms. This can occur because wide dynamic range neurons transmit the pain signal in a way that makes it difficult for the brain to localize the exact origin of the stimulus. Now, let's quickly review why the other choices are incorrect. Answer choice A, referred pain due to trigger points, is incorrect because it does not follow the typical pain pattern associated with right elbow pain. Referred pain usually follows a predictable pattern. For example, trigger points in the right shoulder may cause referred pain in the right arm, but they are not likely to cause pain in the left arm. Answer choice B, puncture of the radial nerve via the needle, is incorrect because it is virtually impossible to damage a nerve via a dry needle. Dry needling is generally very safe and rarely causes harmful injury unless the therapist is negligent. Answer choice D, mismanagement of signals in the secondary interneuron, is incorrect because the secondary interneuron is not responsible for sending pain signals to the left arm. Instead, it is responsible for determining whether or not pain signals will reach the brain. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing neuromuscular-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.